We're currently seeing a steady rise of cases in parts of the country.
As we all know, there has been a relaxation of mitigations, of people not wearing masks indoor.
We encourage everyone to use the menu of tools we have today, including wearing a mask, getting tested, accessing treatments early if infected, and getting vaccinated or boosted.
Here we go again. Team Biden warning us that we should all mask up, get a bunch of boosters because COVID cases are rising. Now, I've told you many times, cases are not what matters here. Overridingly, it is hospitalizations and deaths in ICUs directly related to COVID, not a COVID test case positive when you're in there for some other concern. There's also a phenomenon that many don't seem to notice. 3 of the highest vaccinated states, Rhode Island, my home state of Connecticut, and Massachusetts, are in the top 4 for high infection rates. That's not all. 7 of the top 10 most vaccinated states are also in the top 10 for hospitalizations. Joining me now is Dr. Peter McCullough, cardiologist, author of Courage to Face COVID-19. Dr. McCullough, how can the most vaccinated states be the ones with the most infections? Not following.
SARS-CoV-2, the Omicron variant, is finding pockets of susceptible individuals. These are largely people who have taken 1, 2, 3, or 4 vaccinations, and they've actually contracted the virus. So they're not previously, they haven't previously had COVID-19. They're susceptible, and the vaccine is not protecting them against the current Omicron strains. And so that happens to be in the most vaccinated states.
So the virus is escaping the vaccine because it's obviously evolving. So it's called vaccine escape, I believe?
Yeah, it's antigenic escape. Now, the respiratory illness is providing base protection, for a lot of the unvaccinated have already had COVID, so they're already safe. They're protected against severe disease. But I do have patients in my practice like this, Laura, and there are some with severe symptoms, but they're largely people who have taken the vaccine, but they haven't yet had the respiratory illness.
Yeah, so you have fewer, is it N antibodies over time? According to this new study that just came out, I guess at the end of April, very significant study. We're going to be talking about it later. You have fewer an antibody response in the vaccinated. Is that correct?
It's true. The vaccine actually may hold back a full protective state of immunity after the natural infection arrives in the vaccinated individual. This is worrisome because it may set them up for yet another infection down the line.
Now, Dylan Byers is reporting that NPR is keeping a really strict mask policy in place, even creating a snitch line, Dr. McCullough, to rat out colleagues who aren't abiding by it. So if they don't comply with it, I guess they're going to be fired. Reaction to that?
You know, we just need to abandon any type of directional authority placed on masks. Masks really only have a role for healthcare providers, patients who we're dealing with sick patients, people working at close range. Public masking doesn't have a role, and discrimination has no role at all in our society.
Dr. McCullough, thank you so much. Great to see you as always.